Healthcare Improvement Scotland, Person-Centred Health and Care Collaborative, an inspirational journey. The continued commitment as part of the Person-Centred Collaborative has been recognised. We have been and will continue to make sure that what matters to people is at the heart of how health and care services are designed, delivered and improved. Since 2013, the Collaborative has brought amazing people together to learn, to share knowledge and to celebrate the improvement culture.
So your job, if you are early adopters, is to persuade the yellow box.
We've been invited to connect with others, share best practice, listen deeply and commit to learning.
Don't try and persuade everybody. You'll just get frustrated and lost.
Reconnect with our core purpose.
Maybe I could ask you to spend a moment with yourself and ask yourself, what is the deeper purpose of your work?
So I used the improvement methodology to think about
Take action, be effective.
And that was not to assume we know what matters to the children.
So I was fortunate enough about 2
To be
years
innovative.
ago to come from Sweden and talk to us about initiatives, patient-centred initiatives.
We've shared and learned. And we've reflected.
I was off yesterday.
My chair, I sit down and I actually look at who I'm dealing with.
The patient attended to all his plans, was very happy, got his defibrillator and went home.
We've heard from people willing to try new things and we've celebrated their success.
He won the competition and got the gold medal.
To make this happen, we've applied and adapted quality improvement tools and methods. We've asked what changes we can make that will lead to an improvement, and we've listened to people to see if those changes really have made a difference. We've listened deeply to the power of stories from patients and carers.
My life living with the neurological disorder gives me a chance to explain to people the active on this service.
The most effective tool we patients have is to tell those stories. And why? Because those stories evoke feelings.
Right to the end of her life, my mother was able to be brought back to a sense of herself by music.
To affect her being recognised as Joan Whitelaw anymore, to affect her being part of her community, to being viewed just as a person with dementia, we were both falling apart together.
We've listened to each other and we've promised to learn, and we will continue to act and improve.
The first thing we'll probably do is the introduction.
Posters above the bed to say what matters to that patient.
Listen more to patients and their families. Involving and hearing the person's voice and to validate that experience.
To always be evaluating your practice and finding ways to make it better.
If you've all got good departments doing something really well and works well with the staff, then just clone it.
And we've brought our ideas together to form a great vision to help us continue to improve the future of our services. The Collaborative is a fantastic achievement. We should celebrate being part of it. The rewards have been recognised already, and we will continue to work with organisations across health and social care to make sure that what matters to people is at the heart of how health and care services are designed, delivered and improved.
So the trick we're trying to learn or trying to prove around all of our improvement programmes in Scotland is the ability to move from best practice to common practice. How do we spread?
There's fantastic work going on there where service redesign is being really person-centred, led by good quality conversations with people, their carers, their families. Hugely, hugely encouraging.
Healthcare Improvement Scotland will focus on 3 key strands: using health and care experience data to drive improvement, integrating person-centred approaches into other improvement programmes, connecting people with person-centred health and care best practice. Focusing on these 3 areas lets us build on the improvements we've generated through the Collaborative. Keep making a positive difference.